up with the research question and hypothesis to the literature review. Please join me in welcoming our distinguished speaker, Dr. Anas Al-Hamam.
Thank you very much, Dr. Dunya. I have answered most of the questions. With the same methods in the diabetic people or in patients presenting to the ER or in pediatrics. So you might narrow or change the population, and that is a valid reason to do the test again or to do the study again. You might want to do the same things that was done, for example, was done as a chart review. You might decide you want to do a prospective cohort study, or you might decide to go for a randomized controlled trial, which is a better form of scientific research. So the idea might be the same, but the way that it's being conducted and the way that the data is being collected or the population has been changed, so it will result with new conclusions that will be added to the body of knowledge in the topic that you've chosen. So the idea is to build on existing knowledge. You might get a frame to do your methodology by doing the literature search. So when you look at what have been done, you might think, okay, well, the best way to do this is, for example, to collect blood samples. And then you find that somebody else did it in a different way. They did it not with doing blood samples, but with doing imaging, for example. Okay, so you may get an idea of how other people did it, and you might build on that. So this is why you need to do the literature search. So once you have the relevant information, you did your search, and we're going to go through a full-length example in the body of this presentation, okay? You need to look at the conclusions that other people have had in their studies. Obviously, the conclusions depend on the type of study and how well the study was done, so you kind of need to do a critical appraisal of every study that you include in your literature review. Obviously, you don't need to do it yourself. You can go to professional sites that have this done. The idea is to assess the strengths and weaknesses of these studies. So the study that you're basing your assumptions on, or that you're basing your knowledge on, is it a good study? Is it a bad study? Is it a weak study? You might get better ideas by looking through all the things that were done. And whenever you mention the results of someone, you have to cite their study. You have to mention that this was done by Ash-Shahrani et al. Okay, so I will take a study done by Dr. Muhammad Ash-Shahrani, and I will mention his results, and I will mention where I got this from. So I got this from the study that he did in 2007, for example. Okay, so this helps you to avoid plagiarism. It helps you to basically tell people where you're getting your information so that they will actually believe you. So they might believe you at face value, but if you have somebody who's going to use your study in their own research, they will want to find out, where did you get the information that you're putting in your background, that you're putting in your discussion, in your conclusion. So you need to cite this and to allow them to go and look at it for themselves. And I cannot tell you how many times you find things that have been fudged out. Unfortunately, it's unethical, but a lot of people put in either studies that you cannot access, studies that don't exist, studies that have nothing to do with the information that the author is talking about. So for example, let's say I'm talking about the use of morphine in heart failure, and I cite you a study, and if you go to that study, you're going to find that that study talks about diuresis in the sickler. So no relation. So things like this, unfortunately, you can find throughout the literature. And the idea for you is to avoid all that so that somebody who's following your work will actually be able to trace every bit of information that you have presented in your article and build on that for their own research to further the information that we know about the topic. Okay, so the use of a literature review in your study can be done in a number of ways. You can use it in it should say chronologically. Okay, this is a mistake. So chronologically means you can start with the oldest studies that have been done on the topic. So maybe a study that was done in 1933 or a study that was done in 1907. And then you will go through the literature as you go through the Second World War and post-war era and what was done in the 80s and then what was done in the 90s and so on. So you can take and you can put your literature review in your study in a chronological method. You can have it as a theme. So for example, if we're talking about trauma, these are the studies that have to do with brain injury. And then they're followed by the studies that have to do with neck injury. And then they're followed by the studies that have to do with chest injury. They're all about the trauma. However, you can put them into themes depending on how you're presenting the data and what you're studying, obviously. You can have them done in methodological classifications. So you will mention all the studies that were observational trials. So they were simply retrospective chart reviews or prospective cohort reviews. And then you will mention the randomized trials and then randomized double-blinded control trials, and then the multi-center studies, for example. So you will go from weak evidence, stronger, 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 until you reach things like systematic reviews and meta-analyses, which are kind of the most highest form of studies that you can find. So you can put your literature review in whatever manner you see fit to help you deliver the information in your article. You can have it based by theory. So for example, you can have the studies that talk about a certain cellular intermediary compound in sepsis and what the theory is, and then you can put other studies that support a completely different theory. Okay, so you can put it by theory. When you're using this to set up your scene. Okay, so the first thing that anybody looks at when you pick up an article is the introduction or the background. Okay, so that is where you're telling the reader what it is you're doing. What are you talking about? What's the topic? What is the problem that you are tackling? Okay, so you're setting up the scene. It gives you an overview of the main points. Okay, so if, for example, I'm talking about head trauma, okay, so what's the problem? What's the incidence of increased cranial pressure in traumatic brain injury? And where did I get that information from? So based on study by Dr. A, B, and C, they say that the incidence is 20%, for example. However, Dr. E, F, and G say that it's actually much higher in the younger population because, for example, the teenage population are more reckless and therefore the trauma is more aggressive. So this is the idea. It gives you a framework to start to talk to your reader, to tell them what you're doing, what is your project, and what is your question, and how you're going to go about proving whatever it is that you want to prove, or looking into whatever it is that you're trying to research. Okay, so what's the ideal information that you need to give your reader? The ideal information basically is a combination. Is it the most current information that changes every few years? In some cases, it changes every few months. Okay, is it the exact information? You need exactly what you need without all the bits and pieces and details that you have. Is it the most reliable? Am I only going to use things from medical databases, nothing from Google, for example? Is it the most comprehensive and complete? Is it the most easily accessible? Maybe yes, there's a lot of information in journals that I cannot access because I have to pay. Whereas there are, free access articles for the public. You can go and look at those, but they're not going to have the same information as the ones that you have to pay for. So is that the ideal information? Is the ideal information the most accurate one or the most affordable one? In fact, the ideal information that you want to give your reader is a combination of everything. Now, because of that, and because of the era that we live in, you are in constant information overload. Okay, where do you get your information? Do you get it from textbooks? Do you go back to Peter Rosen's comprehensive emergency medicine and you take it from there? Textbooks are usually out of date. If the textbook comes out today, it is already 5 years out of date. Are you going to go to the guidelines? Well, those have problems of their own, simply because guidelines are basically the points of view of a certain group of people or a society or a college based on their assessment of some evidence about some topic. And there are guidelines that are in direct conflict with other guidelines. An example would be, for example, if you look at the guideline for the use of prosthetic-specific antigen, okay, it's the antigen that comes out of the prostate, and having a high PSA is a sign that the patient might be having prostatic cancer. There is a guideline by the Urological Society of America, USA, that if you have a patient who's more than 50 years old, you should do PSA to screen for cancer. On the other hand, the US Clearinghouse guideline, which is another society, says that you should not use PSA to screen for cancer. So you can see how getting the information is in of itself a problem. You can go to critically appraised topics. These are basically professional groups on the internet that go through journals and studies, and they tell you what they think, and they tell you why they think the way they think. You can go to specific sites such as UpToDate and WebMD and Life in the Fast Lane and see what the experts are saying. So I might decide to go to an article written by Professor Gary and see what he thinks. Again, this is just information that I can mention, and I can say in my research, according to the editorial by Professor Gary Velk, he said 1, 2, or 3. And of course, I can go and search the main medical databases. And this is what we're going to do here. Okay, so basically, there are many sites online that actually provide medical information. So, for example, Best Bets, WebMD, this is a fantastic site. Medscape, everybody knows that. Definitely the Cochrane collaboration. This site provides one of the most fantastic and high-level evidence in multiple topics. The Agency for Healthcare Research and Quality is another source of guidelines and studies. The National Guideline Clearinghouse, as I said before, and obviously the American College of Physicians, and everybody obviously knows UpToDate. So you have tons and tons of sites to get information from, and the idea is for you to get the most comprehensive literature review for your question. Of course, Life in the Fast Lane is a very well-known site to emergency physicians, and the 5-minute consult is another one of these sites. The idea is please do not use Google to search for medical information. And I know that this is very tempting for students and it's very tempting for interns, but asking something like this, the risk of using streptokinase a second time to Google, it's like you're coming to the hospital, instead of going inside and asking the doctor for advice, you're asking the security guard whether or not you think that you should continue on your hypertensive medication. Okay, so please try to go through the proper medical search engine or the proper medical sites. Now, it doesn't mean that Google is useless, but please don't use this as your main search site. In fact, you can see there are many medical databases that you can go through. For example, the BMJ best practice, the clinical key. A lot of people know about the clinical key. The collaborative for radiology, EM medicine, the European PubMed Central, the King Abdullah bin Abdulaziz Health Encyclopedia. Okay, Medline, everybody knows Medline, and we're going to talk about Medline for a good part of this presentation. Okay, so you can see here you have tons and tons of databases to go and research your question. So for example, let me just show you the difference between Medline, which is PubMed, and EMBase, which is the European version of PubMed. Okay, so this is provided by the National Library of Medicine. It's been there since 1966. There are 20 million citations plus. Okay, it covers almost 5,000 different publications, all aspects of healthcare, and it's the good thing about it, obviously, that it is free for the public to use it, and it's updated every week. In contrast, EMBase, this is European-based, and it's done by Elsevier, and it's been there since 1984. It has about 2 million citations, not as big. However, it contains a lot of the European literature. It contains other languages, so literature that has been, medical studies that have been done in German or in Italian or in Dutch or whatever language you have. However, the thing is that you have to pay for it. So do you have access to this or not? Makes a difference that if you do have access through it, whether you pay for it yourself or you go through your institution, which usually has a membership, or through your library, is going to affect your literature search. So the more comprehensive, the better you have it. So for example, imagine if you have question and you do your literature search, and then one of your colleagues brings you a copy of a study that was exactly the same as the one you're going to be doing, but you didn't find it in your literature search because it was on a different database. So how are you going to do your search? So the steps to do your research: number one, you have to structure your question in the proper way. And we're going to go through this in detail in a minute, okay? So your question has to be answered from a proper place. It has to be, if it was a yes or no thing, if there's a guideline already to answer your question, then you're not actually answering something that wasn't done. Okay, so general questions that are open-ended are very hard to research. That's why we said you have to have a specific question. Okay, so you have to have a question with searchable terms. The question has to have items in it that you can actually search. And one of them has to be a mesh term. Now we're going to come to mesh terms in a minute. I'm going to show you how this is being used. Then we're going to use the Boolean operators to either expand, or in other words, explode your search, or narrow or focus your search. Now, for those of you who don't know what a Boolean operator is, it's something you've been using throughout. And we're going to go through it again after a couple of slides. I'm going to show you how you can use this and manipulate it so that you can do a very comprehensive search for the literature that was done for your question. So when we talk about exploding your search, it means making your search more general. And the more general you make your search, the more sensitive it becomes that you will be able to pick up every single study that was done in that topic. Now, there are some things, when you do a general search, you get, for example, 500,000 studies. Now, that's too much. So what you need to do is to focus your search or narrow down your search parameters so that you get something that is basically searchable, a number that you can read and review that is not completely out of bounds. Number four, you have, once you have your list of your articles, now you have to set the limits. Are you going to look at literature within the last 10 years? Are you going to look at all the literature that has been done throughout history with this topic? Are you going to have it in the pediatric population, in the elderly population? So you're going to set your limits to do the search within the question parameters that you have put. And then you will do something called chain citing. So once you get a study that is addressing your topic, now you can go to the literature review in that study and look at what they used as a literature review. So you can go from study to study to study. So you pick up the article and you go to the literature review and you look at that review, and then you find another study that addresses your question, and you go and pick that article up and look at their literature review, and so on and so on and so forth. So this is chain citing. You have to assess the results of your research. So after you've done all of this, is this what you wanted? Did you actually find out everything you need to know about the topic that you're studying? Or did your search return too few results or too many results? In which case, you have to find a way to refine your question or explode or focus your search. Okay, so you must ask the question in the proper format to begin with. So how do you do that? Well, you can ask a novice question. This is a general question. What do you know about ACE inhibitors in heart disease? It's very open. It's very big. If you put this in PubMed, ACE inhibitors and heart disease, you're going to get 20,000 citations, 20,000 articles, if not more. So you need to structure your question. So an expert question would be, for example, what's the most current evidence regarding the benefit of using ACE inhibitors in the elderly patients with heart failure? If you do something like this, now you've narrowed down what population you're talking about, you've narrowed down the heart disease that you're talking about, you've narrowed down what benefit you're talking about, what drug you're talking about, and if you put that, you get something like 30 articles or 20 articles or even 200 articles. Way, way better than the 20,000 that you used to get. So the problem with searching for the text is that you can have multiple ways of doing that. So let's say, for the sake of argument, this is the question we want to address. So, does smoking shisha cause lung cancer? Now, everybody knows what shisha is. For those of you who don't, it's hubbly bubbly. It's, water pipe, whatever you want to call it. So, does smoking shisha cause lung cancer? That's my question, okay? So if I want to look this up, what are the searchable terms? It's shisha and lung cancer. Now the thing is, if I'm just going to put in the text, how many ways can you spell shisha? And how many names does shisha have? And if you look, all of these are valid. You can call it shisha with double E, with EI, with IE, with an I only, with a CH. You can call it Jirak. You can call it Goza if you're in Egypt. Hubbly bubbly, Nargila, hookah, all of these. So the idea is if you put this term in the field that you're searching, you will only get the articles that have this term. You will not get the articles that have hubbly bubbly. You will not get the articles that have hookah or nargila or water pipe. So you can see just that a single term can give you a lot of problems. So that is with regards to the text, shisha. Now, if we come and talk to you about the disease, which is lung cancer, that on its own has a different problem, even though it's similar. So how many ways can you say lung cancer? Well, you have these many ways. So, for example, cancer has all these names. You can say cancer, you can say neoplasm, mass, growth, carcinoma, tumor, neoplasm. And lung, you can say mediastinal, lung, pulmonary, bronchial. So lung cancer, I can say lung cancer. I can say mediastinal cancer, pulmonary cancer, bronchial cancer, alveolar cancer, small cell cancer, large cell cancer. All of these will mean the same thing. And then I can say lung neoplasm, mediastinal neoplasm, pulmonary neoplasm. So you can see how many ways, if you multiply this, this is a 2,520 searches. Now, obviously, I'm not going to waste my time and put the same question with the different terms 2,500 times. So this is the difficulty that you're facing. So how do you get about doing that? Before we ask that, we're going to basically define what are the Boolean logic operators, because these are the ones you're going to use to do your search. So the Boolean operators are those that basically either add or subtract from your search. So and, or, and not. These define the relationship between the terms. So the default operator in PubMed is always and. So whenever you put, if you put Anas emergency medicine program, that will be read by PubMed as Anas and emergency medicine and program. So you can define the operator itself, or if you don't, the PubMed is going to use and as the default. So what is the or operator? The or operator, for example, explodes the search. So if I say to you, I have 4,000 articles on football, 1,000 articles on hockey, and 2,500 articles on basketball. Now, if I want to combine all of those, I will do a search on football or hockey or basketball. So putting the or operator includes everything. So the or operator is the exploding operator. Okay, it's the thing that makes your search way more sensitive. Obviously, if I'm going to take the 6,000 articles on all three, I'm sure that there's a lot of articles that I don't need. Okay, so yes, it's more sensitive in the sense that I'm not gonna miss anything. I take everything, but there's a lot of stuff and a lot of junk that I don't need. So sensitivity means you're not gonna miss any articles, but you're also gonna you're gonna collect a lot of junk. The not operator is basically to decide to remove part of your search. So if I talk about ulcers, there's 176,000 articles, but I only want the duodenal. I don't want the gastric. So I will write ulcers, not gastric. So it will give me all the ulcers that have nothing to do with the gastric. So this excludes irrelevant information. So things that I don't need, I'm going to use the not Boolean operator to remove it. Now, obviously, you have to be very careful when you do that, because when you remove articles, you will be losing something that might be useful. So you have to be careful when you use this operator. Finally, the and operator is the thing that focuses the search. So if we're talking about how many articles that contain salmonella, 64,000, and how many articles on hamburger meat, and now I want to find out all the articles that talk about both, so I'm going to have this. So it focuses down your search, it makes it more specific, it makes it more to your point, but obviously you're doing that on the expense that you will lose other articles. So here you're getting more specific but less sensitive. So now you can combine them. So for example, if I have salmonella, hamburgers, and eggs, always when you pair the Boolean operators, you are always reading it from left to right. So if I say salmonella and hamburgers or eggs, salmonella and hamburgers are basically this, the ones that are in the middle, or eggs, I'm going to include everything in the eggs. So this is the body of literature that I'm going to be looking at. So it's always from left to right. Of course, you can do nesting, which means you can put brackets around the stuff that you need to do first. So for example, salmonella and hamburgers or eggs. So first of all, you do the search or the basically the engine is going to do the search inside the brackets first. So hamburgers or eggs, that means I'm going to include all of them. And then what I have in common with Salmonella. So this is the body of literature I'm looking at. So you can see how you can deal with this. And we're going to go through a full example in a minute. Just hang on. Now that we've finished with the idea of Boolean, now how are you going to do your free text search? Now, obviously, if you put a word like, for example, something like a free text, okay? Basically, anything that has this word is gonna come up. So when you're searching for syntax, anything with this is gonna come up. If, for example, you want exactly that, you will put it in between quotation marks. So that is only going to have this word. If this word doesn't come up, it's not going to be in the search. Okay, so you can search with a truncation. So for example, if you put immune and then star, everything that starts with immune is going to come up in your search. So if you take the trunk and then everything else, so in other words, it's going to look like this. So all of these are going to show up in this search. So when you put immune star, immunocompromised, immunocompetent, immunodeficient, immune complex, compromising, immunity, everything that starts with the trunk that you used, doesn't matter what the end is going to come up. So you can use truncated searches to explode your search for literature. You can use even a limited truncated. So when you use immune star 3, that means it will end up with 3 or less letters. Okay, so immunocompetent, which is more than 3, is not going to show up, while immunity and immunize will show up. Now this is found in some databases. It's used in Embase. We don't have it in PubMed. You can find it in Ovid. So it's just ways of looking for literature. Sometimes when you put a question mark in the middle, you look at the different spelling between, for example, American and British spelling. British spells pediatrics P-A-E-D, whereas Americans spell pediatrics P-E-D. Okay, so these are all tools you can use for search. Now, the sensitivity of your search, the more sensitive your search is, the more general and exploding it is, it means you're gonna encompass a larger volume of literature that will not allow you to miss any article of importance. Now, obviously, doing that, you're going to get a lot of junk. In contrast, a more specific search becomes more precise, less references, but they're more relevant to what you're doing. And the idea is to have a balance between a sensitive and a specific search. Okay, so how do you increase your sensitivity and specificity? You increase your sensitivity by broadening your question. So instead of having the literature done on the topic, instead of looking for the ICU patients, I'm going to look in the entire population. Instead of looking in the last 10 years, I'm going to look in the last 50 years. So this is broadening your question. Okay, you can use truncation to explode your search. You can use the OR Boolean operator. You can increase your time frame. On the other hand, if you need to have it more specific, you will be doing the opposite. So you'll limit your time. You will use the AND operator. You will limit your population, and so on and so forth. Okay, now that you've learned all the basics, let's go ahead and see how this works. You remember I mentioned mesh. Your question should contain searchable terms, some of which are text and some of which are mesh. So what the hell is mesh? Mesh is actually a database. It's short for medical subject heading. You remember this table when we said, when we're talking about lung cancer, there are so many ways we talk about lung cancer. Mesh allows you to search for all combinations of this term by using one of those terms. So here you have 2,500 different combinations: bronchial mass, alveolar growth, small cell carcinoma, large cell tumor, all of these different combinations. I can take one of them, and using mesh, the site is going to look for all the combinations, and therefore I'm not going to lose studies. So if I'm looking for shisha in lung cancer, I will be able to pick up shisha in lung cancer, and I'll be picking up hookah with alveolar tumor, and I will be picking up Jurak with squamous cell carcinoma, and I will be able to pick up water pipe and mediastinal mass, and all of the different combinations with one search. It's absolutely amazing. So mesh is basically a database that has all these medical subject headings. So you can only use mesh for diseases, for the different types of medical conditions. So if you search lung tumor in mesh, you will get the same results as if you put pulmonary neoplasm, and you will get the same results if you put alveolar tumor or whatever combination you get. When you search through mesh, it searches through all the combinations. So how do you conduct a methodological search? So we're going to go through it step by step for the next 15 minutes. Okay, so this is PubMed, and the reason I'm using PubMed, obviously the same thing applies to other sites, but PubMed is the most comprehensive, and it's the one for free, and it's the one that most people use. Now, when you go onto the site, this is the way it looks. Okay, here, this is the search field. So anything you need, you're going to be typing here. Okay, this is the database you're looking at. Now, remember, there are many databases. There's databases for DNA research. There's databases for viruses. There's databases for clinical research. There's databases for animal research. So what the database we're going to be using is the PubMed.gov database. Okay, so here you have, if you want to change to a mesh database instead of the major one, okay, or if you want to go into journals, so this is where you change your databases from. Here you have tutorials, so if you don't know how to use PubMed, it offers you tutorials. And obviously, if you want to get a certain study, this is where you get it, single citation match. So if, for example, through my literature search, I picked up an article, and in the literature search of that article, they are mentioning another article, and I want to get that, I will go to the single site search, and I will put in the journal and the date and the page number and so on and the author, and I will pick up that study. Okay, there is an advanced search button here and here. We're going to be going through that later because we're going to use it. Okay, and this is the way you do your search. So let's pick a question. So the question that I've decided to look for and search: does aspirin or vitamin C have any benefit in the treatment of acute or chronic kidney insufficiency? This is a legitimate question. We don't know what the evidence is. Now I'm going to go and see what has been done in this question if I'm going to use it as a question for my study. So aspirin and vitamin C, these are the text terms. This is what I'm going to search as a text. Whereas acute and chronic kidney insufficiency, this is the disease. This is the medical subject term, because I can say acute kidney insufficiency, I can say acute kidney failure, I can say renal insufficiency. So a lot of different combinations. So you always start your search with the mesh terms. Okay, so first thing you do is you go on the site and you change the database. So I am in pubmed.gov. I'm going to change to the mesh database. And when you click on that, you get into the mesh database. So here you can see it says mesh. Here you can see all the different databases being offered. So there's gene, there's homologo gene, there's conservative domains, biosystems, all kinds of stuff. We are going to go for the mesh. Now, what's our term? Acute kidney insufficiency. So when I put that in and I hit the search button, this is what's going to come. So here, this is acute kidney injury. Okay, this is the result from my mesh search. Okay, now up here in the corner, this is your search builder. So you're going to build your search to make up your question. This is exactly how you do it in a systematic way so that you don't miss articles. Okay, so what am I going to do now? If I go down here, okay, this is what I'm going to find. These are all the different combinations we talked about. So acute kidney injury, kidney injuries acute, acute renal injury, acute renal injuries with an S, acute renal insufficiencies. So all the different combinations in the mesh, I'm going to get simply with searching for acute kidney insufficiency. So I put in one term and I'm going to get all of these. Now, I need to put in the parameters I'm looking for. What am I looking for in acute kidney injury? Well, so when you put acute kidney injury in the mesh, you're going to get this. So I want to look at the complications. I'm not very interested in the diagnosis, nor the cytology, nor the cerebrospinal fluid. I'm interested in drug effects because we're talking about aspirin and vitamin C. I'm interested in the etiology of acute kidney injury, drugs, okay, the mortality, the therapy. So you can choose here whatever parameter that you are looking for that medical subject heading. And once you do that, you put add to the search builder and all of those go in here. So now we've searched acute kidney injury. Now we're going to search the other chronic kidney injury. So this is the second mesh term. Same thing as before. You're going to put here chronic kidney injury, press on search, and you're going to get the same thing. Note that your previous results are still there in the builder. The idea is now you're going to add it. Okay. Now, here, what was our question? Our question was in acute or chronic kidney injury or kidney insufficiency. So we need to use the or Boolean operator. So I'm going to come here, press, I'm going to use or. Again, which part of chronic kidney injury I want, complications, drug therapy, etiology, whatever it is. And once I press on or and add it to the builder, I'm going to get everything together. So here you can see this is the first search I did for the acute kidney injury, and then it says or, and here I get the chronic kidney injury. So you're adding one on top of the other. So this is the parameter I need, or the stuff I need to write in, so that PubMed is gonna go through every single combination for chronic and acute kidney injury. Now, once I have this mesh term set up, I will push search in PubMed. So the mesh is just to get all the different combinations and to tell the site what are you looking for. Now, when you press on PubMed, search in PubMed, you are going to get the different articles that are within these parameters. So once you have all these parameters, you're going to push on search in PubMed, and lo and behold, you get all of these articles. 120,000 articles that have acute kidney injury or chronic kidney injury with all the different combinations. Renal injury, renal insufficiency, acute kidney insufficiency, all of those. And here you have the studies ranging from 1948 to 2020. So now that you've made the search for the mesh terms, let's go and do the search for the aspirin and for the vitamin C, the text terms. So now the text terms. So text, you don't need to go into any other database. You just erase what you have here and you write aspirin and you search. And lo and behold, there are 67,110 articles on aspirin from 1902 all the way to 2020. So all of them. So I've just done the search on aspirin, and then you erase and you do the search on vitamin C. Same thing. So you erase aspirin and you put vitamin C and you put search, and it gets you the articles on vitamin C. Now, once you've done that, you've done the search for the acute kidney injury, you've done the search for the chronic kidney injury, you've done the search for the vitamin C and for the aspirin. Now it's time to build our question. So you press the advanced search button, and this is where the building occurs. So here, when you go to the advanced search, this contains all the searches that you've done. So search number 1 was our mesh. It was 128,000 articles. The aspirin search was 67 articles, and the vitamin C was 65 articles. And now what you need to do is combine them using the Boolean operators. So I'm going to put, does aspirin or vitamin C have any benefit in acute or chronic kidney injury? So acute or chronic kidney injury is already here in search number 1. So I'm going to put search number 3 or search number 2 in between brackets and search number 1. So this is our question. So I'm going to put aspirin, the aspirin search, or the vitamin C search in brackets, and the acute and chronic kidney search. So it's going to be number 2 or number 3. Number 2 is the aspirin, number 3 is the vitamin C, and number 1. And when I do that, it basically gives me my question, and I press and I get the articles that I need that says aspirin or vitamin C and acute kidney injury complication, mesh, and so on. So out of all of these, out of these thousands and thousands of articles, I've narrowed it down to 700 articles. Now, if this is too much, I can now narrow my time limit to the last 20 years or 50 years. Or I can go and narrow and add a population. So, and pediatrics, for example. So this is how you do a search, okay? So running direct text searches will result in either too many articles okay, or too irrelevant. If I did this, if I just put the question as it is and press search, I'm going to get 132,000 articles with aspirin, and with vitamin C, I'm going to get 1,223,000 articles, and it's not going to be feasible. So when you do a literature search, you have to build it up exactly like your question is. And that's why your question has to be very specific. This way, you're going to get all the articles that are relevant to your question and relevant to your study, so that you can actually go to the article and you will look here, the protective role of antioxidants in acute kidney disease. See here, they said acute kidney disease. They didn't say acute kidney insufficiency. So if I wrote insufficiency, this article is not going to show up in my search. Now, the good thing about Medline is once you have something that is particular to your question, you can go and use the artificial intelligence in the site. So similar articles, when you press on this, it's going to give you stuff that is almost the same. So antioxidants do slow aging effects, and antioxidants, do they have a place in prevention or therapy of acute kidney injury? So you can go from one article to the next until you get something that is very, very relevant to your question and very relevant to your methodology. Now, obviously, every single time you do a search in PubMed, if you go to the advanced section, you're going to find all your searches, so you can combine them in whatever combination you want. If I want to do this and I don't want anything to do with, let's say, in pediatrics, I just want to have it in the adults, or I just want to have it in women. So I will put not women with it, or I will go to the age group and change the age group. So you can focus your search or explode your search as you see fit. And finally, if for some reason you're failing, you have to go back and check. Are you using the right database? Are you using the right time? Are you making a question that is really general or really narrow? And are you using the right terms? And finally, when you don't know what to do or you're stuck, please make use of the experts. The experts in this are the librarians at your institution. They are expert literature review searching personnel. They know how to deal with this. They know how to get you the articles that you want. You just have to go and explain your question to them. And if you put the questions in the way that I told you, with searchable text and mesh terms, you're going to make their life easier. They have connections that you don't have. They can, if, for example, an article is found in another database that you don't have access to, they do have access to that. They can access, for example, the Library of Congress. They can access Russian databases. They can communicate with other librarians across the world to get you the articles that you want. So please, if you are doing the research, it's good to do it yourself, but afterwards, let the experts try to do it for you as well. And who knows, maybe you'll get 2 or 3 articles that are going to change the idea you're thinking about the topic and how you're going to run the study. And with that, I would like to thank you for allowing me the time to present this to you and allowing me to be a part of this event. Thank you very much, and God bless.
Thank you, Dr. Anas, for your effort in presenting this amazing, interesting, outstanding, and informative lectures. I really mean it. It's really informative. And
thank you so much.
Very important as a first step to do a research, because we know that most of the people doing research, they don't know how to do literature review in a correct way. So thank you. And I would appreciate if you can answer these couple questions, which is in Q&A.
Okay, so the questions, when doing a literature review, how long is it acceptable to go back in the literature? It's up to you. And it depends on how much literature that has been done. For example, I'll give you a very simple example. I had a study that was proposed to the Internal Review Board on a drug called Epredol. Epredol is like salbutamol. It's a beta-2 agonist that's being used for bronchial asthma. The difference is that it's an injectable, short-acting beta-2 agonist, and it's selective. It's just beta-2. It doesn't cause tachycardia. Now, when I proposed the search on this, the only articles I can find were like 5 or 6 articles from the 70s. There was nothing done on this afterwards. So, for example, I had to go all the way to the 50s and see if there's anything. And all I ended up with was about a total of 10 articles, and that was it. So this is something that was not researched a lot. So you have to go back. If it's something that, you know, has a lot of literature on it. So for example, if you're talking about cardiac arrest and epinephrine, tons and tons of studies. So you can go back as much as you need so that you can get the amount of literature that you need. Of course, the more, the bigger the time frame, the more comprehensive it is, okay? But it's also more effort and more articles to go through and more data to sift through. So I hope that this answers the question. It's up to you, okay? Second question, should we search for short form, for example, GIA or juvenile idiopathic arthritis? That's the idea. The MESH database doesn't care how you write it. So if you write sickle cell disease, SCD, in MESH, it will give you all the combinations, okay? That's the nice thing about MESH. So you put in one medical subject heading and it will give you every single combination that is in the other articles, okay? What are the top free medical search engines? Obviously PubMed, EMBase, Ovid. There are so many, but by far, obviously, Medline and PubMed is the major one because it's first of all, it's for free, so everybody has access to it. Plus, it's the most comprehensive engine. It has the most citations in it. But every now and then, if you are going to be meticulous, or if you don't find your topic in PubMed, you might find it in a medical database in Europe or in South America, for example, in which case you will retrieve the article in Spanish and then have it translated, okay? So this is how you deal with this. Thank you. In regards to your example, aspirin and kidney disease, can you do all the research in MESH? MESH only has to deal with medical subject heading. So if you put aspirin, it's not going to respond properly. So it's basically made so that, because we have so many names for the different diseases, that we have different combinations. So it might work, but it's not made for that. It's made mainly so that you don't have to repeat the search with all the different combinations of the disease. Any other questions?
Okay, thank you, Dr. Anas, for your responding to answering attendee questions. We reach the end of day. So I'd like to thank our amazing, outstanding, special and distinguished speakers for today, Dr. Mohammed Al-Shahrani, Prof. Gary Wilk, and Dr. Anas Al-Hammam. for their excellent lectures they have provided. This will help us to plan what we need to do next in the coming days. We reach the end of the day. We hope you benefited from the delivered lecture by our outstanding speakers. Thank you for your will to participation. I sincerely hope you have enjoyed today's lectures and see you tomorrow. We wish you all the best in your research. But I want to answer one question which is not related to any specific lectures, because we receive a lot of questions in that kind, which is, can we have the recorded lectures? Yes, we will send to you a recorded lectures, but after we finish the first part. So it will be by Thursday or maybe a couple of days after. And it will open for 1 month, then it will be closed. This is just to accommodate your busy schedule, because I know a lot of you are busy and you couldn't make it live session. And thank you again for your interest and participation in this course. And see you tomorrow. See you, Dr. Anas Al Hammam.
Thank you very much.
Thank you. Thank you.